Welcome to today's comprehensive guide on recognizing early heart failure symptoms. Did you know that your body could be desperately trying to communicate vital health information to you right now? Information that might literally be a matter of life and death, yet you might be completely unaware of these crucial signals. Statistics reveal that more than 6 million Americans currently battle heart failure. The alarming reality: the majority fail to identify these critical warning indicators until their condition has significantly progressed. Recent medical findings demonstrate that countless individuals mistakenly attribute these preliminary symptoms to natural aging processes, everyday stress, or simply being physically unfit. What they fail to understand is that their cardiovascular system is urgently attempting to convey something absolutely essential. In today's presentation, we'll explore 13 crucial early indicators of heart failure that the vast majority of people consistently miss. Some of these revelations might genuinely shock you, like a particular symptom that manifests when you lean forward to lace your footwear, or the reason you're unexpectedly awakening during the night requiring additional pillow support. Now, let's examine the first indicator that could signal cardiovascular complications. Warning sign number 1. Breathlessness during physical activity. The initial red flag that countless people dismiss as simply getting on in years is experiencing difficulty breathing during previously manageable activities. This doesn't refer to being winded following vigorous exercise. We're discussing feeling breathless while ascending a single staircase or walking to retrieve your mail. Research conducted by the American Heart Association confirms that this type of activity-related breathing difficulty represents one of the earliest and most prevalent indicators of heart failure. Your cardiovascular system isn't functioning efficiently enough to supply your muscles with adequate oxygen during physical exertion. When your heart cannot maintain proper circulation, your respiratory system becomes strained as your lungs attempt to overcompensate for this deficiency. The crucial distinction between typical tiredness and heart failure manifestations lies in the pattern of progression. If you observe that previously effortless activities now cause breathlessness, or if you must pause and recover during routine tasks, this represents your heart's distress signal. Medical research indicates this symptom frequently emerges months before other apparent heart failure signs become evident. Never dismiss this as merely being physically unfit. Sign number 2. Breathing difficulty when lying flat. Orthopnea. Here's a symptom that typically develops so slowly that individuals don't recognize its abnormality, requiring increasingly more pillows to breathe comfortably during sleep. This condition, termed orthopnea, serves as a revealing indicator that your heart struggles to pump effectively. When you recline horizontally, gravitational forces no longer assist your heart in returning blood from your legs and lower torso. If your heart has weakened, blood can accumulate in the pulmonary veins, the vessels responsible for returning blood from your lungs to your heart. This backup results in fluid seeping into your lungs, creating breathing difficulties when lying down. Studies from premier cardiology institutions reveal that orthopnea occurs in approximately 80% of heart failure patients. What makes this symptom especially treacherous is its gradual development. You might begin with 1 additional pillow, progress to 2, then eventually find yourself sleeping in a reclining chair, because it's the only position allowing comfortable breathing. Many individuals rationalize this progression, assuming it's merely a personal preference or comfort matter. However, if you've transitioned from sleeping flat to requiring multiple pillows or even sleeping upright to breathe properly, your heart is conveying something significant. Sign number 3. Sudden nighttime breathlessness. Picture awakening abruptly, struggling for air, feeling as though you're suffocating. Your heart races frantically, panic overwhelms you, and you must sit upright or stand to regain normal breathing. This frightening experience represents paroxysmal nocturnal dyspnea, a serious heart failure warning indicator. This symptom develops because during extended periods lying down, fluid accumulated in your legs throughout the day redistributes across your body, including into your lungs. Your already compromised cardiovascular system cannot manage this sudden fluid volume increase, resulting in acute breathing difficulty that startles you awake. Clinical research shows this symptom typically manifests 2 to 4 hours after sleep onset and can represent one of the most terrifying experiences for heart failure patients. These episodes often compel individuals to rush toward open windows or doors, desperately seeking fresh air. What makes this symptom particularly hazardous is that people frequently attribute these episodes to nightmares, anxiety disorders, or sleep apnea. While these conditions can indeed cause sleep disruptions, the specific pattern of awakening gasping for breath, especially with increasing frequency, demands immediate medical assessment. Sign number 4: overwhelming exhaustion and decreased physical capacity. The fourth warning indicator is arguably the most frequently overlooked: an overpowering fatigue that renders daily activities exhausting. This isn't ordinary tiredness that resolves with rest. It's persistent exhaustion that persists despite adequate sleep and makes previously enjoyable activities feel impossible. When your heart fails to pump efficiently, your body redirects blood flow away from less essential organs, sending it to vital areas like your heart and brain. This means your muscles receive less oxygen-enriched blood, resulting in profound fatigue and weakness. Research demonstrates this symptom can emerge months before other obvious heart failure indicators become apparent. What's particularly concerning is how this fatigue impacts exercise tolerance. You might notice that your recovery period following physical activity becomes dramatically extended. A brief walk that once left you feeling invigorated now requires a lengthy rest period. Activities like carrying groceries, climbing stairs, or even bathing become exhausting endeavors. The progression often occurs so gradually that people adapt their lifestyle without realizing it. They begin avoiding activities, creating excuses, or attributing limitations to aging. However, this progressive stamina decline isn't normal aging. It's your heart struggling to meet your body's fundamental requirements. Sign number 5: lower extremity swelling. One of the most observable early heart failure indicators is swelling in your ankles, feet, or legs, medically termed peripheral edema. This isn't temporary puffiness from prolonged sitting. This represents persistent swelling that progressively worsens, particularly by day's end. When your heart cannot pump effectively, blood circulation becomes impaired and begins pooling in your lower extremities. Additionally, your kidneys, receiving reduced blood flow, begin retaining sodium and water. This combination forces fluid from your blood vessels into surrounding tissues, causing swelling. Research published in leading cardiology publications shows peripheral edema presents in approximately 70% of heart failure patients at diagnosis. The swelling typically begins in feet and ankles, potentially progressing upward to calves and thighs. You might observe that your socks create deep impressions, your shoes feel tight by evening, or rings that once fit comfortably now feel restrictive. The pattern is significant. Heart failure-related swelling is usually symmetrical, affecting both legs equally, and worsens throughout the day due to gravitational effects. If pressing on the swollen area leaves an indentation lasting several seconds, this could represent a warning sign. Sign number 6: rapid fluid-related weight gain. Perhaps the most quantifiable early heart failure warning is rapid weight gain from fluid retention. We're not referring to gradual weight gain from overeating. This is sudden increase occurring over mere days that should trigger immediate concern. American Heart Association guidelines specify that gaining 2 to 3 pounds in one day or 5+ pounds within a week warrants urgent healthcare provider contact. This rapid weight gain occurs because your failing heart triggers hormonal responses, causing your kidneys to retain salt and water. Each kilogram of weight gain represents approximately 1 liter of excess bodily fluid. Studies emphasize this weight gain precedes other symptoms becoming obvious. You might not yet notice swelling or breathing difficulties, but weight measurements don't deceive. This is why physicians often instruct heart failure patients to weigh themselves daily. It serves as an early warning system preventing hospitalizations. Heart failure weight gain differs distinctly from normal weight fluctuations. It's consistent, upward trending, and often accompanied by bloating or fullness sensations. Sign number 7. Increased nighttime urination. A symptom that often confuses people is suddenly requiring more frequent nighttime urination compared to daytime, a condition called nocturia. While many attribute this to aging or pre-bedtime fluid consumption, it can actually represent an overlooked early heart failure indicator. During daytime upright activity, gravity causes fluid accumulation in your lower extremities. Your struggling heart cannot effectively pump this fluid back to your kidneys for processing. However, when you lie down at night, gravity helps redistribute this pooled fluid back into circulation. Your kidneys, suddenly receiving this fluid surge, work overtime processing it, resulting in increased urine production. Cardiology Journal research shows nocturia can represent one of the earliest heart failure signs, sometimes appearing before more obvious symptoms like breathing difficulty or swelling. Patients often report awakening 3 to 4 times nightly to urinate, with each episode producing larger volumes than usual. This pattern is particularly significant because it represents your heart's inability to handle normal daily fluid distribution. Sign number 8. Nighttime cough or wheezing when reclining. A persistent cough appearing exclusively at night or when lying down represents another subtle yet significant heart failure warning. This isn't a productive cold cough or dry allergy cough. It's often described as a nagging dry cough disrupting sleep that improves when sitting upright. This nocturnal cough occurs through the same mechanism causing orthopnea. When lying flat, fluid accumulated in your body during daytime redistributes, potentially causing mild lung fluid buildup. Your body's natural response involves coughing to clear what it perceives as airway obstruction. Medical literature describes this cough as often worsening during early morning hours, sometimes accompanied by slight wheezing. Patients frequently report the cough produces minimal sputum or occasionally brings up white or pink-tinged frothy mucus, indicating lung fluid presence. What makes this symptom particularly deceptive is that people often blame allergies, post-nasal drip, or sleeping conditions. Warning sign number 9. Heart rhythm abnormalities or palpitations. Your heart's rhythm can provide crucial early heart failure warnings. Palpitations, the sensation of your heart fluttering, pounding, or skipping beats, often accompany early heart failure stages as your heart works harder, maintaining effective blood circulation. When your heart muscle weakens, it may develop irregular rhythms while struggling to maintain adequate circulation. You might feel your heart racing even at rest or experience the unsettling sensation of skipped heartbeats. Some describe it as feeling like their heart is performing somersaults. Major cardiology center research shows cardiac arrhythmias, particularly atrial fibrillation, represent both heart failure causes and consequences. This relationship is bidirectional. Irregular heart rhythms can lead to heart failure, and heart failure can trigger dangerous arrhythmias, creating a cycle that can rapidly deteriorate if untreated. These palpitations are often more noticeable during rest or when lying down, and may accompany anxiety or unease feelings. While palpitations have many causes, when occurring alongside other heart failure symptoms, they warrant serious medical evaluation. Warning sign number 10. Dizziness or near fainting episodes. Dizziness, lightheadedness, or near fainting episodes can represent frightening early heart failure indicators. These symptoms occur because your weakened heart cannot pump sufficient blood, maintaining adequate brain circulation, especially during position changes or exertion. When you stand quickly or exert yourself, your body normally compensates by increasing heart rate and adjusting blood vessel tone to maintain blood pressure. However, a failing heart cannot make these adjustments effectively, leading to temporary brain blood flow drops, resulting in dizziness, lightheadedness, or severe cases, fainting. Studies indicate syncope occurs in approximately 20% of heart failure patients and can represent an early warning, sometimes appearing before other obvious symptoms. Episodes are often triggered by sudden movements, prolonged standing, or mild exertion that wouldn't have previously affected you. What makes this symptom particularly dangerous is that people often attribute it to dehydration, medication side effects, or inner ear problems. While these can certainly cause dizziness, when combined with other heart failure symptoms, syncope represents serious cardiac output decrease. Warning sign number 11. Digestive issues and abdominal discomfort. Digestive symptoms might seem unrelated to heart health, but persistent abdominal bloating, appetite loss, or feeling full after consuming small amounts can represent early heart failure signs. These symptoms occur because heart failure doesn't just affect your heart. It impacts your entire circulatory system, including digestive organ blood flow. When your heart cannot pump effectively, gastrointestinal tract blood flow decreases. Additionally, fluid can accumulate in your abdomen, and your liver can become congested with blood that isn't being pumped efficiently. This creates a cascade of digestive problems, significantly impacting quality of life. Research shows these gastrointestinal symptoms are frequently overlooked by both patients and healthcare providers because they seem unrelated to heart problems. Patients report feeling uncomfortably full after eating just a few bites, experiencing persistent nausea, or having bloated feelings that don't resolve with typical digestive remedies. Heart failure liver congestion can also cause upper right abdominal pain or discomfort. Some describe a constant pressure or fullness sensation in their belly, making eating difficult. Warning sign number 12. Shortness of breath when bending forward. Here's a symptom so specific that most people have never encountered it, yet it's one of the most revealing early heart failure signs. Bendopnea. This represents shortness of breath occurring within 30 seconds of bending forward, such as when tying shoes, picking up floor items, or leaning over a sink. Bendopnea was first characterized in medical literature in 2014, and research has demonstrated it's a remarkably specific indicator of elevated heart pressures. The physical mechanism. When you bend forward, the position increases abdominal pressure, pushing against your diaphragm and temporarily increasing chest cavity pressure. If your heart already struggles with elevated filling pressures, this additional stress can quickly trigger shortness of breath. Studies published in major cardiology journals found bendopnea presents in approximately 30% of heart failure patients and strongly associates with more advanced disease and increased mortality risk. The symptom is so reliable that researchers consider it a non-invasive method for assessing heart pressure without invasive testing. What makes bendopnea particularly significant is its specificity. Healthy individuals rarely experience this symptom. Warning. Sign number 13. Poor circulation indicators. The final warning sign involves circulation changes you might notice in your extremities. Cold hands and feet, even in warm weather, or narrow pulse pressure can indicate your heart isn't pumping with sufficient force to maintain proper circulation. When heart failure develops, your body prioritizes blood flow to vital organs like your brain and heart, reducing circulation to hands and feet. This leads to persistently cold extremities, sometimes accompanied by bluish fingernail or lip tinge. You might notice your hands and feet feel cold to touch even when you're warm, or they take much longer warming up than usual. Narrow pulse pressure represents a more subtle sign requiring blood pressure monitoring. Normally, there should be a 40 millimeters of mercury or greater difference between systolic and diastolic blood pressure readings. When this difference narrows significantly, it can indicate reduced stroke volume, meaning your heart isn't pumping sufficient blood with each beat. Medical research shows these circulatory changes often develop gradually and can represent early indicators of decreased cardiac output. If you've recognized yourself in any of these 13 warning signs, don't panic, but don't ignore them either. Heart failure, when detected early, represents a manageable condition. The key lies in recognizing these subtle signals your body sends and taking action before medical emergencies occur. Remember this crucial point. These symptoms often develop gradually and can be easy to dismiss. You might think you're simply aging, becoming unfit, or experiencing stress. But when multiple symptoms appear together or when familiar activities become unexpectedly difficult, your heart might be communicating something critical. The power of early detection. Early heart failure detection and treatment can dramatically improve your quality of life and longevity. Modern medicine possesses incredible tools for managing heart failure, from medications that can strengthen your heart to lifestyle modifications that can slow or even reverse disease progression. Engagement request: if this presentation proved helpful, please comment "helpful" below. This motivates us to create more content like this. Please like, share, and subscribe for additional life-saving health information. Thank you for prioritizing your cardiovascular health.